Welcome everyone to today's webinar. I am Robert Kurtz, moderator for the program, which is brought to you by PriorityOne Group. PriorityOne Group is a leading provider of integrated healthcare IT services to organizations including ASCs, medical practices, and hospitals. Our program will begin with a presentation, and we will have a question and answer session following completion of the presentation. You can submit any questions you have throughout the presentation by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Our presenters will attempt to answer as many questions as they can during the time we have. We'll follow up on questions they do not have the opportunity to address. You'll receive a follow-up email shortly after completion of the program. You can submit your feedback or any additional questions at that time. You'll also receive an email within a few days that will include a copy of the presentation and instructions for how you can view a recording of the webinar. It is now my pleasure to introduce today's presenters. Nelson Gomes is a seasoned information technology veteran who has spent the past 15+ years specifically focused on healthcare and has more than 2 decades of IT experience. He is the founder of PriorityOne Group. His method of leveraging technology to help healthcare providers deliver higher quality care while maintaining IT security has made him a sought-after thought leader who is frequently called upon for his expertise by professional groups, associations, and publications. He is joined by Ken Michael. Ken is the founder and vice president of Dox. He is a certified security expert and frequent keynote speaker at Homeland Security conferences. His certifications include CISSP, CRISC, CISA, and Certified Security Analyst. I would now like to turn the floor over to Nelson to begin today's presentation. Nelson?
Good afternoon, everyone, and thank you for attending. I want to say a special thank you for Ken Michael for joining us today from his busy schedule, and we're going to go straight to it. So for those of you who may have had the opportunity to attend any of my webinars or speaking engagements, you know that I love cartoons. So I'm going to start off with this one, which nowadays kind of, in security, it kind of feels that way. So a little bit of humor to start. But our focus today is really on security and disaster planning. So we're going to focus today on a couple things. And here are today's goals. Identify top patient privacy and security concerns. We're going to talk about some compliance and security mistakes we're seeing in smaller medical groups, ASCs as well. Provide some guidance in maintaining proper IT security and compliance. We're also going to share some simple security measures every group should have in place. Provide you with some options implementing disaster preparedness, recovery, and continuity. We'll talk about some possible solutions, demonstrate experience and competence in business continuity, and planning takeaways. So, which leads me to my next slide, which is some headline news that I'm sure that many of you have seen in the past year, where we're seeing more and more attacks, and they're being really focusing on healthcare. And then later on in the presentation, and I'll be providing some statistics on those breaches and why healthcare is being targeted. So also, for those who don't know me, you know that I'm a big stat guy, and so I spent some time in doing some research, and we pulled this information directly from HHS in regards to breaches, involving 500 or more individuals. So by law, if you have in your facility, if there's a breach and it affects more than 500 or more patients, you are obligated to report it to HHS to let them know that there was a breach. One of the things that that these statistics are showing is that 91% of all healthcare organizations report at least one data breach over the last 2 years. So that tells me, based on the audience that's here, there has been several of you that have had some kind of breach. And my understanding is now ransomware is considered a breach as well. Cyber attacks are expected to affect 1 in 3 Americans this year. So that's as a whole, which is pretty scary. So in one way or another, we are being affected, whether we know it or not. Medical records are worth 10 times more than a credit card on the black market. And here's why. With a credit card, you basically have some of the information that a hacker would need. With a patient medical record, they can basically duplicate your identity. So they'll steal your identity because now they know they have all your demographic information. They have your height. They have your weight. They have any of the diseases that you have, any of the other type of medical information that you would share or what a patient would share with you. That information would be also there. So that's why it's worth more on the black market than just regular credit cards. Medical costs victim on an average of $13,500 and 200 hours worth of work to rectify the issue. Now this is an average. There are people that have spent a lot more time and a lot more money when it comes to this kind of stuff. Going back into the stats, and I want to go back and kind of focus on theft. If you notice that theft is the leading cause of breaching, and again with unauthorized access. And some of it has to do with unauthorized. To be quite honest, is we've seen it that just people have more access than they're supposed to have, and they don't even know it. And we're going to get into more of those details. But I wanted to share that with you. So more stats here. Data breaches are costing the healthcare industry $6 billion annually. So, and we're hoping to see that decline, but unfortunately, I'm not sure if that's going to happen, especially now that, we're seeing an increase in breaching in healthcare, and we're trying to keep up with it. That's for sure. And the one thing that I can say, and Ken is gonna talk a little bit about it more, is it's just not hospitals that are being targeted. Smaller physician practices are also being targeted. Just because you're the small guy doesn't mean that you're not susceptible. Believe it or not, you are. And we're going to go into that and talk a little bit about that. More than 1,500 covered entities on the HHS Wall of Shame. For those of you who don't know, if you just go to hhs.gov and just type and go into, if you see there's this link here, and you follow that, you have the ability to look at a report throughout the country of everyone that's been affected by breaches. Now, this just doesn't show covered entities. It also shows business associates that have been affected. So a good example would be if one of our clients was breached, and which they haven't, but if they were and it affected their systems, more than 500 or more patient records, that would show on that, what we call that wall of shame. So, and you can actually filter it by state, filter it by location, and you can filter it by, whether it's a business associate or a covered entity. Now, one of the things that I have asked in the past is, if you're dealing with a business associate and you want to know more about them, go here, go to this link, and you'll be able to do some research and see if they've ever been part of a breach or not. It gives you a little bit more information about them. If they do, then ask the question. And then, we're going to talk about a little bit about what the patients are seeing and what they're asking for. So we're seeing, 58% are somewhat concerned with privacy of their medical records. That's a pretty big number. So 58% of the people that are coming to your doors, and the doctors are seeing them, and if you have an EHR, they are concerned about their medical records. 52% are somewhat concerned about security, and more than 13% are withholding medical information. Now, this is important to know. So patients are afraid to put down information about their health because it might get breached. So what does that do? That then really handicaps the physician from doing their job because they're not sharing that information. And the reason they're not sharing it is because they're afraid that there's going to be, some kind of a breach, or that their privacy is not being securely withheld, held. So that was a surprising number. medical identity theft is rising rapidly. It can be more difficult to detect than other types of identity theft, and it's the truth. So those are the things that we're seeing patients that are struggling with, and rightfully so. But enough of the bad news. Let's, what we want to do is, and later on in this presentation, we're gonna share some best practices for you as how you can secure that information and what you should be doing on a regular basis to give the patients the confidence that their privacy is secure. So with that said, here's some of the common security mistakes that we're seeing: outdated policies, inappropriate access to PHI. So you have people within your organization that don't need certain access to the EHR, let's say, and they're giving that access. There's no documentation of what your security program is. There are some concerns with keeping up with the regulatory requirements. Poor or non-existing agreements with business associates, and I want to touch up on this. This is something that you should be updating on a regular basis. If you have someone that's a third-party vendor that is accessing or touching PHI or has the ability somehow to access that information, they definitely should have a business associate. Now, with that said, just because they sign a business associate agreement doesn't mean you, as a covered entity, you're okay. The days of sticking your head in the sand and saying, "Well, it's not me," it's now on the business associate is untrue. You are still responsible. What we have shared is we have our own with our clients, our healthcare clients. We follow the same guidelines that you follow. So we have written policies and procedures on PHI and HIPAA regulatory requirements. So our staff here goes through a training program, just like your staff should be going through on a regular basis, just to make sure that they understand HIPAA. If they don't take the test, they can't come to work. We also have our own notification methods as far as if a breach happens, what do we do? We follow the same guidelines as a covered entity should do. And one thing that you can take away is if you're going through a process where you're working with someone that is a business associate, ask them the question, please, can you provide me with a list of the guidelines that you are following in order to maintain compliance? Poor or incomplete security risk assessment, that's one of the things that we have seen, and I think it's one of those, you don't know what you don't know. So it's important to have something and understand the state of your environment, whether it's good, bad, or indifferent. It's important to have that document. I can tell you that at a recent event where I spoke, I had the Federal Bureau of Investigation and I had OCR, Office of Civil Rights, who are the folks that are going to come in and do the audits and investigation for breaches. The first thing they're going to ask you is, where's your risk assessment? That's the first thing that they ask. So that's something that you should be performing on a regular basis once a year. So whether it's an in-house IT or it's a third-party vendor that you're using, but at the same time, it's just not IT related. No designated privacy officer. Each covered entity needs to have somebody with that label as being the HIPAA privacy officer. These are just one of many. Ken, is there anything that you want to talk about on as far as this slide is concerned, as far as some common mistakes that you're seeing as a security expert?
Sure, you hit this one spot on, Nelson. I would also add to that an overall lack of understanding of security or understanding how important security is. It's security is the glue that holds everything together here. If you don't have an understanding of it, then, like you said, you don't know what you don't know. So you need to turn to the right entity to help you out.
Thank you. Okay, so common security mistakes. What we're seeing is, and I have this first point that says focusing too much on compliance. Obviously, you can never not focus too much on compliance, But don't forget, security is part of it. Compliance is one piece of the puzzle. Security is that other piece. Lack of encryption. We're seeing more and more mobile devices that are out there that are not being encrypted. Even though you have, technology of how you access the patient data as a single painted glass, where the data is not sitting on your laptop, but it's sitting somewhere else. I highly recommend it, and it's part of our standard for all our clients. If you have a mobile device, that device needs to be encrypted, and the costs are not astronomical. They're not very high costs in order to do it. It's how you're going to manage it. If that laptop is lost or stolen, you need to be able to say, there wasn't any patient data on it. But it's a lot easier when OCR investigates and say, yeah, we lost a laptop, it's encrypted, and here's the proof. Allowing physicians and staff to use personal mobile devices for work purposes, that's a big no-no. And I know it's hard, especially with phones. There should be some policies in place that you have. People that bring in their own laptops into the workplace, that's a big no-no as well, because there can be security risks there. Failure to change passwords regularly, it should be a standard practice. I know that in our experience, staff sees it as inconvenience, but you need to somehow put some kind of process in place where those passwords get changed at least at a minimum twice a year. Failure to remove user accounts of departed staff members. One of the things is we keep seeing those accounts for users, whether it's on the EHR side or whether it's on the domain side of things. An Active Directory where someone leaves, those accounts are still active. It's very simple. Deactivate them and make sure that you document it. Securing only critical servers is not enough. Just putting security measures into just your mission critical servers, whether it's your practice management system or whether it's your EHR, is not good enough. It has to go across the board. Allowing staff to take PHI and sensitive data home. That's a big no-no. If you're going to do it, and it's in a mobile device, then make sure it's encrypted. If you're going to do that, make sure there's a policy that follows that as well. Poor budgeting or investing in the bare minimum necessary. So, and I think that's just a lack of education, not knowing what you need or not knowing what are some of the implications of not having the right solutions in place. So it's important to focus on that as well. Ken, would you like to talk a little bit more on this slide and anything else?
Certainly. Thank you. Lack of encryption. The slide that you showed earlier on showing the different percentage breakdowns of how data is lost. If you had encrypted the laptops and if you had encrypted your portable devices, you would have taken care of 30% of all those possible risks. 30% just by encrypting. Encrypting the full hard drive on laptops so that if someone loses it, it becomes nothing more than a 6-pound boat anchor. Encrypting memory sticks. I can't tell you the number of times that we find loose memory sticks laying around with incredible data on it that people just never encrypted. Thank you.
Thanks, Ken. So, which leads us to the next thing, the growing epidemic of ransomware. Ransomware, obviously everybody has heard about it. There's different strands of ransomware. We're seeing more and more of this type of breach. Now, if you are attacked by ransomware, there was a gray area where OCR was like, well, it's not, and it is, but now they've made it clear that if you get hit with ransomware, you need to report it. Now, one of the things I can tell you, and people are not doing and should be doing, is reporting these breaches to the Federal Bureau of Investigation. The FBI is your friend when it comes to these things, and I'll tell you why. And I was pleasantly surprised when we had a event earlier in the year that they actually discussed, some of the things that they're doing in order to prevent it. They can help through the process, and their recommendation is do not pay the Bitcoin ransom. If you pay it, you're going to be vulnerable for doing it again. Because if they did it once, they're going to be able to do it again. So their recommendation is don't do it. They have methods on being able to help you and bringing that data back. But you should definitely have some tools in place in order to prevent that. And we're going to talk about that a little bit. But again, I go back to this slide, and if you look at it, 88% of the target is healthcare. 88%. Now, if you look at the impact, we're going to talk a little bit about disaster recovery, because this is technically a disaster. If your systems get encrypted and you can't open your stuff, you can't do anything. So what ransomware does, it basically takes over your data and encrypts it. So they're saying, well, now this data is encrypted and you can't get to it. So they're not deleting it. They're holding it ransom by encrypting it. So you want it back, you're going to pay us in order to unencrypt it. And you got to go through a Bitcoin. And the only reason they do it through Bitcoin, because there's no way to kind of track you back for the hackers to get tracked back on how they're getting paid. And the longer you wait, the click of the cost goes higher. So one of the things you can take out of this is use the FBI to your advantage. If you work with an IT firm, have your IT firm contact them. Now, what we've done in the past, we have, our clients have certain measures in place that if they do get ransomware, we go through the process. We take a snapshot of the system that has been infected by a ransomware, provide that information over to the feds, and we have a recovery process, with the systems that we have in place that we recover. But that just gives more information for the FBI to be able to investigate it and help us to deter hacking. I mean, they have a whole division in just dedicated to cybercrime. They actually been doing a lot of awareness this month because it is National Cyber Awareness Month, and it's something that that we're joining forces with them to provide awareness. So it's a growing epidemic, and it's not going anywhere. Ken, what are some of the things that you're seeing with ransomware out in the real world?
Well, ransomware, again, it encrypts files, but if it can, it will encrypt every single file on your entire system. I've seen this shut down hospitals. I've seen it shut down complete organizations where they cannot function whatsoever. Ransomware has changed how backups and recoveries have been. This is the single biggest change as far as backups go. It used to be people back up on a nightly basis. That has radically had to change because of ransomware. Snapshots throughout the day is the only protection against ransomware if you get hit with it. So it will go and try to attack every single file in your system. It's vicious.
Thank you, Ken. So improving compliance and security. So there's a list of things here that we do. And one of the number one on the top of my list is conduct an annual risk assessment. Now here's what I will tell you. We do this for our clients. However, it is verified by a third party, because that's like bringing in your accountant to audit your books, right? You're not going to want the same person. So if you're going to bring in if you currently have an IT firm and they're doing risk assessments, which is fine, just make sure that it's getting certified by some kind of third party, that the information that they're providing you with is accurate. Because who wants to basically run a report and find things that are wrong with their system that they should be fixing, right? So conduct an annual risk assessment, because it gives you a clear picture of what of the findings. So here's what they found, right? Here are the gaps, and then here's how you're going to address it. That's how you should look at it, right? And when you're going to address it, you want to, it's what we call a remediation plan. Have a plan in place to address any of the issues that you have. If you happen to get audited by OCR, that's the first question that they're going to ask you. Well, let me see your risk assessment. And based on that, they're going to come back and say, okay, I see there's some things here that haven't been addressed, but based on your remediation plan, you're going to address it in the next 3 or 4 weeks or whatever the case may be. I'll give you a perfect example. Several years ago, Windows XP was end of life. What we found were many of other IT firms, which is unfortunate, use scare tactics. And their tactic was, well, by this date, you have to replace all your Windows XP machines, because if they're not replaced, then you're going to get fined. It's not true. What you need to do, or what we did with all of our clients, we identified those machines and said, okay, you need to put in a plan on how you're going to replace them. Because if you're a small organization and you need to replace all of them, financially it might be hard for you to do in 1 month. So you spread it out throughout the year. As long as that plan is clearly defined, then you're good to go. As long as OCR wants to see that you are going to do something about it. Again, not doing something and being ignorant about it is not gonna fly with them. So it's about the effort that you're putting into it. Understand your data. What's sensitive? Where does it live? Is it in transit? Is it just sitting on your servers? And if it is, how is it sitting there? And what's the importance of that data? Establish a compliance and security policies and standards. Those and that's a moving target. So that's something that you need to look at every year. Develop process and audit your rules. Perform penetration testing. So if you have some way of you're going to the outside world and you have and you're going out to the internet, you need to be able to do some of that penetration testing from the outside to understand what your vulnerabilities and what your risk is. Ken and Dox are highly do this on a regular basis, the small and large firms, so they understand this more than anybody else. Provide ongoing education and training. It's very important. Another area that we feel that needs to continue. What we're finding is a lot of the staff is just training. They don't understand what they should open, what emails they shouldn't open, and what are some of the risks of doing certain things and not doing certain things. And education is a big piece of it. So educating the staff for them to understand the implications of not following certain security standards and what it can cost the organization and for themselves. Implement physical security controls. So that's more of if you have a data center or if you have a small closet where you have your servers in it, make sure it has a lock on it. So those type of things. If you have certain areas, having access control so you can monitor who comes in and out, having video surveillance, that's a whole part of that physical security controls. Encrypt mobile devices, I think we talked about that already. HIPAA and business associates, it's important that, just because they sign a document and they're a business associate, that doesn't mean that they're not liable and that they're going to be liable. The liability always falls on the covered entity. You can go back to them and sue them for it, but you have these things in place, and it's not to do that. You want to be sure that you don't have to go down that route. So make sure that you talk about those guidelines. Develop an incident response time and test it. And we're going to talk a little bit about that more in the disaster recovery piece of that we're doing. So have a plan in place. Test the plan. I can assure you that once you test it, you're always going to change it. So if you're going to do it at a minimum once a year. Test it. Keep up with the changes in rules and regulations, federal, state, and accreditation. This is a struggle, I can tell you, but fortunately there are third parties out there that can help you with the compliance side of thing and making sure that you're keeping up with things. We do it ourselves. We have a third party that we work with that, you know, we ensure that we have all our policies and procedures in place and that we're following federal state regulations. Standardize endpoint security tools and reevaluate every year. So what tools are you using to protect your system? So to make it to put it in simple terms, are you using some kind of virus scanning on your servers and on your workstation? If you are, they should be standard across the board. They should be managed standard across the board. Are you just using that? Are you using some kind of web filtering? If you're not, then you should look into that. And that's part of the whole budgeting that you're going to do, you know, every year and seeing if you have those tools or not. With that said, Ken, is there anything that I missed or anything that you want to talk a little bit more regarding this slide?
Nelson, that's a great list. What we find with the medical community is that they don't know what they don't know. So it's really, really important that you choose a good vendor / business partner that you feel that you can trust to help you better understand this list and to work through all the different areas of it, including other things that could be added to this list are encrypting backups. Most people forget all about the backups, but you don't have to worry about if you lose it. Again, it's encrypted, so it's not a big deal. But this is a great list, Nelson. Fantastic.
Thank you. Well, that said, that kind of covers the security part of the presentation. We're going to move on to you know, how to preserve critical business functions in the face of a disaster. If you have any questions as far as security is concerned, we highly recommend that you go ahead and submit those questions. Ken and I will be more than happy to address them at the end of the presentation. So let's talk about how to preserve critical business functions in the face of disaster. We're in our, for those of you who may not remember, but I think this week is the 4-year anniversary of Sandy, and I'm sure that we all felt it. So it was a very tough time in the industry where some people were down and out, and I think you know, I know several clients that are still struggling to come back from that because of how it affected them and how it affected their business. Just because you can't open the doors is just one piece of it. You know, you got to think about, if I can't open the doors and I don't have my systems up and running, I can't bill either. So that's one of the things that we really saw that hurt a lot of practices was cash flow and not being able to access their systems in order to do their billing because they didn't have the right solutions in place. But we'll talk a little bit more in detail on that. So back to the usual stats. 80% of business have no plan. That's a number that is real. They have that's not going to happen to me mentality. 68% of businesses who experience a disaster and don't have a plan go out of business within 2 years. 1 in 5 organizations will suffer a major IT disaster in 5 years. I'm sure that some of you have incurred that one way or another. So a disaster doesn't mean that you know, you have a flood or that your facility goes up in flames. It has to do with outages. So if you're out for more than 2 to 3 hours and it affects your business, that's considered a disaster. A company experiencing a computer outage lasting more than 10 days will never recover. That's the truth. And that's a tough one. Like I said, you know, we had clients out in Staten Island that were affected, and they couldn't open up their office for 4 weeks. They're still suffering. They're still trying to recover financially from that. So, Con, here's the breakdown for some of the reasons for data loss. 30% of it is human error, software corruption, viruses, theft. Hardware failure is a big one as well, and that has to do with, you know, having systems in place where those systems are end of life, and that they need to be upgraded, and warranties are not being upgraded, and they're just trying to get as much out of them as you can. We're seeing the industry do a great shift where hardware in the local facility is somewhat non-existent, where we're seeing more and more going to the cloud. But in healthcare and in the small practices, depending on your specific specialty, it depends. For example, one of the things that we're seeing is GI is definitely something that we're seeing they're keeping their servers there, because when they're doing their scopes, it's images, it's high definition images. If you're going to bring that through the internet or through a connection, performance is going to get affected. Now, performance, and as well as I'm not I don't call myself an economics person at all in healthcare, but I know that GI is driven with volume. So if your performance of having the ability to do scopes, and having stuff on site is going to be faster than doing it off site, it's going to affect your numbers. So it's about crunching. In some other type of practices, it makes sense to use a solution that's on the cloud. So it's important that when you go through that process, understand how it impacts your business. So one of the things that we looked at is in disaster recovery is recovery time objective. How quickly should your critical service be restored? RPO, recover point objective, and how much loss and data loss can be accommodated. Now this all is scalable, right? But it also comes with a price. So the less downtime you want to have, and the more recovery point objective that you want to have, the more it's going to cost. So you have to say that, okay, I'm good with 8 hours of downtime and being able to go back one day. So if I lose a day of any of the work that I had, I'm okay with it. Or maybe you're not okay with it. But typically, in my first conversation with the doctors, not with the administrators, because sometimes I think reality between those two is a little bit different. We'll tell them, okay, what's your how do you want to recover? And we'll go through the process, and they'll tell us, oh, we can't be down more than an hour. I said, okay. We come back with a solution, and it has a hefty price tag. That 1 hour really quickly changes into 4 and 8 and 12 and 2 days. So it's the perception. So again, we go back with educating and making sure that everybody's involved with that, making that decision. So components of an affected.
I would also add to that.
Okay.
I would also add to that about doing some tabletop exercises where, so if you're willing to lose 8 hours of information that you had, when you're doing restores take time as well. So you're losing on both sides of the coin there. You're losing the day that you had, plus when you do a restore, all that time is you're down and out as well.
Right.
From the
Good point.
Computer systems.
Good point. Thank you, Ken. So here are some of the components of effective business continuity and disaster recovery. So operational disaster recovery and continuity plan, the recovery facility, process and procedures, and finally design, resilience, and recoverability. Those are the 4 main components. Again, this basically shows your downtime in reference to your implementation's cost. The lower the downtime, the higher the cost. Now, it's important to note when you are recovering, or you're putting in your plan for disaster recovery, and you're bringing back your systems, you still have to have CIA. You have to have the confidentiality is important. You still have to maintain it. The integrity of your systems you still have to maintain, and availability needs to be is the main focus. You need to ensure that all three of these areas are addressed when you are in disaster recovery mode. So the focus is really when you start with this is planning it. So here's one of my favorite cartoons. I'll give you a couple of seconds to read that. That should not be your plan. So there's areas of developing and implementing a disaster recovery and business continuity. And we'll go through those different steps. Project initiation. It's a project. So if it's a project, you need to document and say, okay, here's how we're going to start with this project. Doing the risk assessment. Now this, again, goes in line with the other risk assessment that you're doing in regards to security, right? It falls in line. So this is another component now of your risk assessment is disaster recovery and business continuity. What am I, if I need to recover, how am I going to, what are my risks right now? Business requirements and impact analysis, right? So what are my business requirements that I need to run and function in the case of an emergency, right? You may not need email, but if it's important, then you need to address that, right? Phones. What happens if my phones are down? What do I do? Do I go through a third party for service? Do I let it go and I forward it to an answering service? What do I do? So you need to think about that. Okay, if I have patients that are coming in and are scheduled to come in, but my site, the system is down, when do I call them? When do I notify them? I need to bring out, our practice management systems and the EHR systems. What's the impact of them being down? Obviously, they're mission critical systems, right? Can you work without having QuickBooks for the day? All those little things to take in consideration. It might be important for QuickBooks for the finance person, but maybe your organization is small enough that your finance person only comes 2-3 times a day. So, recovering QuickBooks may not be the top priority. So understanding how that impacts your business is very important. Solution, design, and documentation. Once you have those three basically defined and documented, now you can start you can start building your solution design. So basically, with the information that you've gathered from all those three other steps, now you can design it. And then what you're going to do is take a look at it and several times and adjust it as you go through it. And then implement it. You're going to implement the plan and look at the roadmap and say, okay, I know that in order for me to implement this, it's going to take me 4 to 6 weeks. And here are the different tasks in those 4 to 6 weeks that need to be completed, as an example. Then the implementation itself and testing. This is the most important piece of it, is testing. Because you're going to test it and you're going to go back to business requirements and impact and then the design. Those two are going to get impact on a regular basis. So once you're comfortable with it, you keep testing. And one of the things that we do with our clients, so we do, with the larger clients, so we do mock tests. What that means is we have time where we spend and we schedule them, and all the point of contacts and leadership know when those tests are going to happen. They're pre-scheduled. Usually they happen once or twice a year, but the staff has no clue. And we bring down the systems. And when we bring down the systems, we want to see as a whole how the staff reacts. Do they follow the process? Or is there a flaw in the plan of bringing back systems and recovering? And it's an ongoing thing. You just don't do this once and then forget about it. You have to adjust it every year and make sure that that you're updating. New systems may come into play. New requirements as far as business may be necessary to change, because it might impact something in the business that you're doing that needs to be done and adjusted. Ken, anything you want to add here?
If everything went perfect in your test, you didn't test hard enough.
Good point. Thank you. Okay, so business impact. So we talked a little bit about this. Obtain formal agreement from senior management for each time critical business resource. Maximum allowed outage. Quantify loss due to business outage. Does not estimate the probability of kinds of incidents. Only quantifies the consequences. So this is the focus on the business impact. We talked a little bit about this already. Recovery strategies. How are you going to recover? It has to go through a process depending on how large your organization. Some of these, you might not need to go through, but different technical strategy, different costs and benefits. How to choose. Careful cost-benefit analysis and driven by business requirements. That's what has to drive this, right? Is if I'm going to recover, what am I going to recover? What are the requirements that I need to keep this thing going? Continue some of the other strategies you should address recovery of. Business operations, facilities, and supplies, users. So if there's an outage where users can't work from the office, do they have the ability to work from home? And if they're going to work from home, remember security, right? How are they going to work from home? So think about that. Network data center. So this applies more for the larger organizations where they're going to take, they might have a secondary site where all that data is, and they'll bring it up that way. Or if the data is off-site, they need to bring it back. So it really depends on your organization and whatever model you're going to follow as far as disaster recovery. And there's different strategies. There's cloud-based solutions where you're basically backing up all your data via the cloud, and it's there. And you can do two different methods where you're recovering the data from the cloud locally, or you're firing it up from the cloud and running it that way. Now, you need to take in consideration that if you're going to do that, performance might not be the best, and maybe you need performance to be the best. But again, you have to analyze that and identify if you're going to be down and out, how is that going to impact performance? So if performance is important for you, then fine. Then just understand that there's going to be a cost associated with that. Data center solutions where you have a secondary site where your data is at, you can just fire it up from there. Multiple sites is another one where we're seeing data being replicated through other sites. What we're seeing a lot nowadays is what they call hybrid models. So where you're doing local backups to an appliance, so it's an appliance-based solution, and that appliance is basically taking snapshots of all your mission-critical servers. So what you identify as mission-critical, and it's taking a snapshot of those servers. If your servers fail, for example, then you can fire them up in this appliance and be able to access them locally through there. Now, there might be instances where you can't do that, and you can't bring you can't recover locally. So then this data that is also an appliance is also being replicated to the cloud. So now what you can do is recover it to the cloud, or basically fire up that server that you had in your office and fire it up on the cloud and run it through there. There might, again, performance might be an issue, but at least, the way we kind of explain it is, at least you can do 70, 75% of the functions that you were trying to do. If that's not good enough, that's fine too, but just understand that there's costs associated with doing it that way. The final phase is really testing, maintenance, awareness, and training. Testing is, again, just like Ken mentioned. If you tested and everything went fine, then you didn't test hard enough. Maintaining it, quality control of your systems, and if you're adding new systems into the mix, into the environment, understand that once you do that, then you add that to your infrastructure, then that also has to be added to your plan. Awareness. Awareness and training for me kind of fall under the same category, is to make everyone in your staff understand the importance of disaster recovery. And they know what their role is in this, and if a disaster happens, what is their role? What are they supposed to do? And at the same time, train them. If you have a policy and a process in place, make sure they understand it. It should be part of their onboarding as a new staff member into your organization. That's kind of what we do. When we bring on a new person, we go through the whole process with them of how to, in this case, on how to manage our clients. But at the same time, in the face of a disaster, here's your role, and here's what is expected of you, and here's the systems that are in place in order to do that. And we train them on what they need to do and how they need to do it. So these for me are the four most important areas. Kind of just talk about a little bit. We already talked about unless it's tested, you don't have a plan. Kinds of testing, a structured walkthrough will help, because you walk through the process. So go through what we've done in the past is we go through the whole clinical workflow when a patient comes through the door to see your receptionist through the whole process. A checklist, obviously, do a simulation. That's some of the things that we do. A parallel and full interruption. Those are some of the things that you can do. This is the final phase of maintenance. Once it's kind of, I call it the circle of life here. So exercise, maintain the plan, the project, understand the critical systems, develop a strategy, develop the plan, embedded business continuity. Again, it keeps going in a continuous circle. The one thing I want to emphasize is the solution. It's important that it's a very good solution, and that you try to keep it as simple as you can. Now, the simplicity of it is going to be based on the simplicity of your infrastructure. So it's very important to have both in place. If there's a lot of complexity within your organization, you need to understand that there's going to be complexity in your business continuity plan, and there's more room for error. So try to identify some of those gaps in the plan because of that complexity. So to summarize, disaster recovery planning is crucial. Your approach needs to be practical, and the plan needs to be executable. Test much and test often. Ensure that the plan is maintained. So those, as far as disaster recovery is concerned, and maintaining it and going through it, this is somewhat of the summary that I would give. I'm going to turn it over to Ken for his comments, anything that he wants to add to the disaster recovery piece of it. So Ken.
Yeah. So Nelson again hit it spot on. Is you have to test. You don't know what's gonna. It's amazing the things that you learn of the nuances that you took for granted that might break if you aren't testing. So that's the biggest thing that we find, is that people they'll gloss over it too quickly and say we've got it down, and once they go through the individual steps, they realize that there were different dependencies that had to be brought up in certain orders that people didn't think about.
And with that said, I'm going to turn it over back to Robert to see if there's any questions out there. So Robert.
Excellent. Thank you, Nelson, for a very informative presentation, and Ken, certainly for jumping in throughout to share your insight. As Nelson noted, we're now going to begin the Q&A portion of the program. As a reminder, you can submit your questions by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. Let's jump right into this. It's a rather direct question. So this all sounds great, but it sounds expensive. Is it? Nelson?
And here's the perception, and perception is reality. The perception is that it is expensive as far as security is concerned and disaster recovery. Yes, you know, a lot of people think, well, that's only more for the big hospitals, and you know, those are the type of things that we can't afford to implement, and that's not necessarily true. The only way you're going to know what you need is really to, again, go back to that risk assessment and really get an understanding of what you have. There are a lot of tools and a lot of solutions out there that are cost effective, that are going to be able to protect you and are going to be able to assure that if you need to recover, that you have an opportunity to do so. So it's one of those things that you know, it goes back to education. Educate yourself. You know, talk to your IT service provider, your trusted advisor, because that's what they should be, and ask them that question. Let them provide you with some of that information. And it's okay. You know, and it's okay to get second opinions to make sure that that you feel comfortable that you have the right solution. But as far as costs are concerned, again, I have to go back to it. Really, the costs are going to be higher on the disaster recovery side of things, and it really depends on your recovery time and what your expected recovery time is going to be. And with that said, I want to ask Ken if there's anything that he wants to add to that.
So on the security side, when we're doing the security assessments, yeah, there are times where we have to tell the customer you have to buy new hardware, but there are so many times when it comes down to processes and procedures that are wrong or not there at all that need to be put into place. So there's a lot of low-hanging fruit items you can do that have very little to no cost, but you have to know about those. And again, that's where somebody like Nelson's organization can come in and help you identify those to knock that stuff off. From a security standpoint, the bad guys, they're going after everybody. They don't care if you're a large organization or if you're a small organization, you're a target. It's a botnet that's going after you, gathering all the information. So, and botnets they're not human, so they don't care the information they're gathering. They're just looking for openings that they can exploit to then, you know, give to the real people. So processes and procedures, there isn't a lot of cost associated with that stuff once you get involved with it.
Thanks, Ken. Any other questions?
Yeah, let's got time to maybe get through a couple more. This person wants to know. It seems like you've discussed there's a lot of moving parts. What's the best way to get started, to get moving?
Well, you got to start somewhere, right? And the best, and I would have to say the one thing that comes to mind is you don't know what you know, right? So you have to know. Start with a risk assessment. Understand where you are. That's a starting point. That risk assessment, that person or organization that provides you the risk assessment should provide you with a couple things. That risk assessment should outline the findings. So what do they find? Clear outline of here's what we found within your infrastructure. Here are the systems in place. Here, you know, somewhat of a fact-finding mission. Once they do that fact-finding mission, they should identify gaps within the different areas of what they're assessing. Those gaps will then come with priorities to say, out of these gaps that were found, these are the items that need to be addressed, and here's the priority they need to take. Here's the timeline that it's going to take to get them implemented, and maybe here are some costs associated with them. Because now you have a clear picture. You know what the priority is, you know what the costs are, and you know what the timelines are. So now that gives you a clear roadmap on what you want to tackle first. And then you have that information in order to make a decision. But without that information and without having that risk assessment, you're not going anywhere. So if there's one thing that I would highly recommend, would be, yeah, definitely having a risk assessment. Ken, is that anything that you would want to add to that?
Nelson, I'm going to try to steal you and add you to my staff. You did a great job.
Thank you.
Let's just get into one last question before we conclude. This is actually, I think, a topic you touched on a little bit, and it sounds like this person would like to learn a little bit more. This person works in a small practice and wants to know why would a criminal go after their practice rather than maybe a larger hospital which has a lot more data?
Well, I'm going to leave that. I think that this is a perfect question for Ken. He's definitely definitely knee deep into this security thing, that we're seeing, and why security becomes an issue. So Ken, can you answer that question for us, please?
Sure. How many hours do I have for this? So the answer to the question is that, again, if you are a smaller organization, you have less money for defenses, and if I can get you with ransomware or criminalware, get them on your machine, then I'm going to try to make it where you're going to have to pay me to get your information back. Small organizations still going to see quite a few patients for me to steal that information, but you're not going to have the same defenses as a major institution with an IT staff of 25, 30 people. So you're an easier prey, easier target.
Excellent.
Great. Thank you.
Thank you, Ken. No, I can say I'm looking at the clock, and I say that's all the time we have for questions. So I'll let our audience know that if our presenters did not have the opportunity to address their question, we'll make sure to pass it along with your contact information for follow-up. If you have any additional questions or would like to learn more about what PriorityOne Group can do for your organization, Nelson's been kind enough to provide his contact information on this final slide, so you can reach out to him directly, or you can reply to any of the emails you've received concerning the program. I want to quickly give Nelson and Ken an opportunity to share final thoughts before we wrap up. I'll start with you, Nelson.
Well, first and foremost, I want to thank everyone for taking the time to attend today's webinar. Security is real. It's something that we're very passionate about. We continue to educate and bring awareness to the community. So I would highly recommend that you continue to educate yourselves as far as security and disaster recovery. Look for us. I feel sometimes that I'm on tour talking about it, but that's part of what we want to do, is educate the community and bring awareness as much as we can. So thank you.
Excellent. Ken?
Security is real. The fines are getting larger and larger. Just for not having a business associate agreement, there was a fine this year for $750,000. There was another fine for $1.55 million for not having a piece of paper. So these fines are for real. On top of the fines, you get the bad press. So you just can't ignore it. It's something you have to really get involved with. Thank you.
Thank you. And again, I want to thank Nelson again for an informative presentation, certainly for Ken for sharing his insight as frequently as he did. And obviously, I want to thank all of the attendees for taking the time to join us today. You'll have the opportunity to hear Nelson further discuss cybersecurity and disaster planning during a complimentary webinar on November 16th, sponsored by Coventus. We'll provide you with the link to register when we send the presentation materials along. This concludes today's webinar. I want to thank everyone again for their participation, and I wish you all a great day. Thank you.
Thank you.